What happens when one of America's most respected nutrition experts becomes his own test subject? Dr. Michael Greger, founder of nutritionfacts.org and author of multiple best-selling books, has spent decades reviewing thousands of medical studies. He's the doctor who doctors turn to for evidence-based nutrition advice. But even he wasn't prepared for what would happen when severe leg swelling forced him to confront a nutritional deficiency hiding in plain sight. After an 18-hour international flight returning from a medical conference in Singapore, Dr. Greger noticed something alarming. His legs and ankles had swollen to nearly twice their normal size. The pitting edema was so severe that pressing his finger into his ankle left a deep indentation that took minutes to disappear. For most people, this might seem like a temporary inconvenience from long-distance travel. But Dr. Greger knew the statistics that most Americans don't. Circulation problems and fluid retention affect over 60 million people in the United States, contributing to more than $50 billion in annual healthcare costs. What made this case extraordinary wasn't just that it happened to a prominent physician, but how he approached solving it. Instead of reaching for the standard medical playbook of diuretics and blood thinners, Dr. Greger decided to test a nutritional intervention he'd been researching. The results would challenge everything he thought he knew about treating circulatory problems and reveal a hidden epidemic affecting millions of Americans. The story begins with Dr. Greger's frustration at conventional medical responses to his condition. Emergency room physicians wanted to prescribe Lasix, a powerful diuretic that forces the kidneys to eliminate excess fluid. Cardiologists suggested echocardiograms to rule out heart failure. Vascular surgeons mentioned compression stockings and elevation therapy. But Dr. Greger had spent years studying research that pointed to a different culprit, a vitamin deficiency so common in America that it's hiding in plain sight. During his flight, Dr. Greger had consumed typical airline meals high in refined carbohydrates and processed foods. Like many Americans, he had inadvertently participated in what researchers call the Great Nutritional Depletion. The standard American diet, aptly abbreviated as SAD, consists of approximately 60% ultra-processed foods. These foods are not just empty calories. They actively deplete the body's stores of essential nutrients, particularly B vitamins. Dr. Greger remembered a series of studies he'd reviewed about thiamine, also known as vitamin B1. In the early 1900s, thiamine deficiency caused a disease called beriberi, which killed millions in Asia where polished white rice was a dietary staple. Medical textbooks taught that beriberi was eradicated in developed countries by food fortification programs. But recent research was revealing a disturbing truth. Modern beriberi was alive and well in America, masquerading as heart failure, circulation problems, and chronic fatigue. The connection became clear when Dr. Greger examined his own diet patterns. Despite being a nutrition expert, his travel schedule had forced him to rely on airport food, hotel meals, and conference catering. All were loaded with refined sugars and stripped grains that his body processed like sugar. Here's where the biochemistry gets fascinating and terrifying. Every molecule of sugar or refined carbohydrate requires thiamine to be properly metabolized. When someone consumes sugar without adequate thiamine, the body must rob its thiamine stores from muscles, nerves, and vital organs. Dr. Greger realized he had created the perfect storm for thiamine depletion. High carbohydrate intake from processed foods, combined with the stress of international travel and disrupted sleep patterns, had pushed his thiamine levels below the threshold needed for proper cellular function. The swelling in his legs wasn't just about salt and water retention. It was a sign that the tiny cellular pumps responsible for maintaining fluid balance had begun to fail. These pumps, called sodium-potassium ATPases, are among the most energy-demanding processes in the human body. They consume 30 to 40% of all cellular energy, constantly working to maintain the delicate balance of minerals inside and outside our cells. When thiamine levels drop, these pumps can't generate enough energy to function properly. Fluid begins accumulating in tissues, particularly in the lower extremities where gravity makes the problem most visible. But the cellular damage goes deeper than just fluid retention. Dr. Greger understood that chronic high blood sugar levels cause a process called glycation, where sugar molecules permanently bind to proteins in the bloodstream. This is what the hemoglobin A1C test measures, providing a 3-month average of blood sugar control. When proteins become glycated, they lose their ability to transport oxygen and nutrients effectively. The blood vessels become leaky, allowing fluid to escape into surrounding tissues. This explained why diabetics commonly develop peripheral edema and neuropathy. But Dr. Greger wasn't diabetic, and his blood sugar levels had always been normal. What he was experiencing was something more subtle but equally dangerous: the early stages of metabolic dysfunction that affects 88% of American adults according to CDC data. Most people showing these signs never get properly diagnosed until they develop full-blown diabetes or heart disease. Armed with this understanding, Dr. Greger designed his own intervention protocol. Rather than suppressing symptoms with medications, he would address the root biochemical problem. His approach focused on 3 key nutrients: thiamine, B1, magnesium, and potassium. The thiamine would restore proper carbohydrate metabolism and protect against glycation. Magnesium would support ATP production, the energy currency needed for cellular pumps. Potassium would help restore proper fluid balance. The dosages Dr. Greger chose were based on therapeutic research, not the minimal amounts found in standard multivitamins. He started with 100 milligrams of thiamine daily, nearly 100 times the RDA. For magnesium, he used 400 milligrams of a highly absorbable chelated form. Potassium presented a challenge since supplements are limited to 99 milligrams by FDA regulations, while the body needs 4,700 milligrams daily. He would need to obtain most of his potassium from food sources like avocados, leafy greens, and low-sugar fruits. Equally important was what Dr. Greger removed from his diet. All refined sugars, white flour products, and processed foods were eliminated. This wasn't just about reducing calories, it was about stopping the thiamine depletion cycle. Every gram of sugar or refined carbohydrate would require thiamine for metabolism, working against his recovery efforts. The first week brought subtle changes that only someone with Dr. Greger's medical background might notice. His energy levels stabilized, and the afternoon fatigue he'd attributed to jet lag began disappearing. The pitting edema in his ankles became less pronounced, though still clearly visible. Most importantly, he began sleeping better, which he knew would support his body's repair processes. But it was during the second week that the dramatic transformation occurred. Dr. Greger had scheduled comprehensive blood work to document his progress, including inflammatory markers, vitamin levels, and metabolic indicators. The results shocked him more than he expected. His C-reactive protein, a marker of systemic inflammation, had dropped from 2.8 milligrams per liter to 0.7 milligrams per liter. His homocysteine levels, which indicate cardiovascular risk, fell from 11.2 mol/L to 7.8 mol/L. Most striking was the improvement in his endothelial function, measured through flow-mediated dilation testing. This assessment of blood vessel flexibility and responsiveness had improved by 40% in just 2 weeks. For comparison, most cardiac medications take months to achieve similar improvements, and they come with significant side effects. The physical changes were equally dramatic. The swelling in Dr. Greger's legs had completely resolved. His ankles, which had been tight and puffy for weeks, returned to their normal appearance. The skin discoloration around his lower legs, a sign of poor circulation, had faded noticeably. Even his blood pressure, which had been creeping upward during his stressful travel period, normalized without any medications. But perhaps most significant was what Dr. Greger discovered about his cognitive function. The mental fog and difficulty concentrating that he'd attributed to travel fatigue lifted completely. His recall during lectures improved, and his ability to process complex research data returned to its peak level. This made perfect sense biochemically. The brain is one of the most energy-demanding organs, requiring optimal thiamine levels for proper glucose metabolism. Dr. Greger's experience led him to investigate how widespread this problem might be in the American population. What he found was disturbing. Studies suggest that subclinical thiamine deficiency affects up to 30% of American adults, particularly those over 50. The elderly are especially vulnerable because thiamine absorption decreases with age, while prescription medications like diuretics and diabetes drugs further deplete B vitamin stores. Hospital emergency departments across America see hundreds of patients daily with symptoms that could be related to thiamine deficiency: fatigue, confusion, heart palpitations, shortness of breath, and peripheral edema. Most receive symptomatic treatments without anyone considering nutritional causes. Dr. Greger realized that many cases diagnosed as heart failure with preserved ejection fraction might actually be unrecognized beriberi. The economic implications are staggering. Medicare spends over $30 billion annually treating heart failure, much of it focused on managing fluid retention with expensive diuretic medications. If even a fraction of these cases involved thiamine deficiency, the potential savings from proper nutritional intervention could reach billions of dollars while dramatically improving patient outcomes. Dr. Greger's transformation also highlighted the interconnected nature of nutritional deficiencies. The improvement in his circulation affected his sleep quality, which enhanced his immune function, which reduced inflammation, which further improved his vascular health. This positive cascade effect demonstrates why addressing root nutritional causes can be more powerful than targeting individual symptoms with medications. The implications extend beyond individual health to public policy. Current dietary guidelines emphasize reducing saturated fat and cholesterol while allowing unlimited refined carbohydrates. Dr. Greger's experience suggests this approach may be contributing to widespread thiamine depletion and metabolic dysfunction. Food fortification programs that add synthetic vitamins to processed foods clearly aren't sufficient to prevent deficiency in people consuming high-carbohydrate diets. For Americans struggling with similar symptoms, Dr. Greger's journey offers both hope and practical guidance. The first step is recognizing the signs of thiamine deficiency: persistent fatigue, particularly after meals high in carbohydrates, swelling in the legs or ankles, difficulty concentrating, muscle cramps or weakness, and shortness of breath during mild exertion. These symptoms are often dismissed as normal aging or attributed to stress, but they may indicate a treatable nutritional deficiency. Testing for thiamine deficiency requires specific blood work that most doctors don't routinely order. The thiamine diphosphate test provides the most accurate assessment of functional thiamine status. However, levels can appear normal even when cellular function is impaired, making clinical judgment crucial in suspected cases. Dietary sources of thiamine include pork, sunflower seeds, pine nuts, and legumes. However, achieving therapeutic levels may require supplementation, particularly for people with high carbohydrate intake or absorption problems. Dr. Greger emphasizes that thiamine supplements are remarkably safe, with no known toxicity levels, making therapeutic trials reasonable for many people. The magnesium component of Dr. Greger's protocol addresses another widespread deficiency affecting up to 50% of Americans. Magnesium is essential for over 300 enzymatic reactions, including those involved in energy production and cardiovascular function. Food sources include dark chocolate, nuts, seeds, and leafy green vegetables, but soil depletion has reduced magnesium content in many foods. Potassium presents the greatest dietary challenge since American diets provide only about half the recommended intake. The emphasis on avoiding sodium has overshadowed the equally important need for adequate potassium. This mineral imbalance contributes to hypertension, kidney stones, and fluid retention. Increasing potassium through whole foods like potatoes, bananas, avocados, and leafy greens is safer and more effective than supplementation. Dr. Greger's experience also demonstrates the importance of eliminating nutritional antagonists. Refined sugars and processed carbohydrates don't just fail to provide nutrition, they actively deplete nutrient stores. Alcohol, caffeine, and certain medications can also interfere with B vitamin absorption and utilization. The 2-week timeline of Dr. Greger's recovery provides realistic expectations for others attempting similar interventions. While some improvements may be noticed within days, significant physiological changes typically require 1 to 2 weeks of consistent nutritional support. This time frame allows for cellular repair, restoration of enzyme function, and normalization of fluid balance. Dr. Greger's story serves as a powerful reminder that optimal health requires more than just avoiding disease. Even nutrition experts can fall victim to the hidden nutritional traps of modern food systems and lifestyle demands. His willingness to share his personal health struggles helps destigmatize nutritional deficiencies and encourages others to consider root causes rather than just managing symptoms. The broader message transcends any single nutrient or health condition. It's about reclaiming personal responsibility for health through evidence-based nutrition while recognizing the systemic factors that make optimal nutrition challenging in modern America. Dr. Greger's transformation in just 2 weeks demonstrates that the body has remarkable capacity for healing when provided with the right nutritional foundation. For the millions of Americans struggling with circulation problems, chronic fatigue, and unexplained health issues, Dr. Greger's journey offers hope that solutions may be simpler and safer than the medical system typically provides. Sometimes the most powerful medicine comes not from a prescription pad, but from understanding and addressing the fundamental nutritional needs that our modern lifestyle has forgotten.